Capnography measures metabolism, which I think is very, very important. If we're trying to assess someone's baseline, we want to see where their metabolism is and to see if our treatment is making things better or if they're getting worse in spite of our treatment or if we need to change our treatment. And so I can honestly say as a flight nurse that capnography has changed my practice. You literally breath by breath can look at the infant or child's capnograph, their measurements, and determine if you're doing things right or if we need to make some changes in treatment. And those changes would be everything from their body temperature to the ventilation, to the inspiration of oxygen concentration, respiratory rate, a number of different factors. I started in EMS in 1991, and it wasn't until I became a flight nurse. I'd worked in the hospital in ICU as a nurse, and then when I became a flight nurse, it was part of just the protocols that we did, and particularly in transport, every time we move a patient, there's potential to pull the endotracheal tube out or just the environmental stresses that we put them through. It's very important that we don't make them worse through the transport, through the experience. And so Mercy Air is a Southern California, actually Southwest United States air ambulance, gave us this technology and some great training to go along with it. And it really, really does make a difference. And the bottom line is the patient outcomes are better. You know, it's interesting, so much of my career has been teaching basic life support and advanced life support, and I used to get really discouraged because so many of our patients die. Once they're in cardiac arrest, sudden cardiac arrest, 95, 97% don't survive. And the ones that do, very many don't have good neurological outcomes. And so I'm really on board these days with the kind of alert model, the life-threatening events, recognition, and treatment. So it's acute, life-threatening events, recognition, and treatment. And it's what we call the peri-arrest. So it is so much better to catch a pediatric patient, an adult patient, as I crudely say, us in EMS, we get kind of graphic with our words, but as they're circling the drain, as we're starting to lose them. So the recent studies show that 61.1% of patients who go into cardiac arrest for 1 hour to 8 hours before they go into cardiac arrest show what we call prodromal symptoms. So they literally give us signs and symptoms that they're going to go into cardiac arrest. And so we need to be alert for those. Capnography is one of the best ways because it is a measurement of metabolism. And if we can watch it trend in the wrong direction, we can say, ooh, we need to get this patient to the hospital. We need to get aggressive with our interventions. And we truly can make a difference so that we don't have to end up doing CPR on these patients and ultimately losing most of them. We get the technology and it's mandated into the services, but that's not what we should be doing. We should get the technology and see the difference and buy into it and believe and know that it really makes a difference. So when the providers are on board with, I'm making a difference, I'm saving lives, reducing morbidity, reducing mortality, it's an awesome technology. And if anybody gave me choice between pulse oximetry and capnography, I would definitely take the capnography.